Hello and welcome to our lifestyle changes with hypertension. But I do need to talk about the inauguration this week. It was absolutely magnificent. I was very concerned that there may be some violence there, but fortunately, there wasn't any. Also, we had some wonderful speakers, and Amanda Gordon was just phenomenal. I hope you wore your pearls that day, and some people are continuing to wear their pearls because they are just so ecstatic about having a Madam Vice President Kamala Harris and President Joe Biden, who picked her as a running mate. He's really done a very good job in picking her. So this week has been a lighter week, and I didn't feel as heavy and as anxious and just really concerned about where the country was going. And I'm happy to say that hopefully and prayerfully that we will get the type of leadership that we've been wanting in these last few years. So let's get started. Earlier on, we talked about how blood pressure gets diagnosed, and that's usually done by your physician, and they usually look at both numbers, and they tend to try to make sure that both numbers meet national guidelines. For example, if your blood pressure is less than 140/90, more than likely your pressure is normal. But if it starts creeping up to above 140/90, that means that you may be on your way to having high blood pressure. So as we stated before, it means that you've had 3 separate occasions when your blood pressure has been greater than 140/90. So today, we're going to talk about how you can optimize your blood pressure and feel in control of it. I think a lot of people feel like, oh, I'm on this medicine and I don't want to take it. And I really don't know what the blood pressure, why I'm taking the medicine. A lot of people will tell you that. And many people want to discount the fact that they have had that diagnosis. But the fact of the matter is, they do have it and they should be taking their medicine. So let me talk about some things that may help you. Number one, you need to know what your blood pressure medicine is first, and make sure you read all the information that the pharmacist gives you, because that will give you a lot of information about the side effects of your medicine. Additionally, you want to know where your doctor wants you to have your blood pressure. In some cases, they want less than 140/90. In other cases, they may want it a little lower than that. So make sure before you leave, you find out exactly where they think your blood pressure should be. Also, let's talk about some of the things that you can do to help your blood pressure be lowered. I can't guarantee you'll be off your medication, but you may not be on as much medication. As people get diagnosed with high blood pressure, a lot of them are carrying a lot of excess weight. And it is called, we have a general way that we discuss it, and it's called the BMI. And the BMI is a standard that we have that gives us an indication as to who is underweight, normal weight, overweight, and who has excessive weight. And it was started so that everybody would be on the same playing field. Prior to that, we had scales from life insurance, and there was a small build, medium build, and a large build, and people decided which build they were. So it was really inconsistent in the way we determined how much weight people were carrying. Now, the BMI is not without its faults, but for now, that's what we're going to be using. So BMIs less than 25 are normal, and BMIs between 25 and 30 are overweight, and anything greater than 30 is excess weight. And what happens is, with a BMI of 30, you're more than 30 pounds overweight. Well, thank you, Mr. Wright. Thank you for joining us today. Glad to see you. So, what do we do about that? Firstly, weight loss, it has been, doctors are always saying lose some weight, but this is a way that you can optimize your weight loss. You can optimize it and feel comfortable that you're doing something positive for yourself. I have been in circles where people saying, oh, my pressure was fine, so I can eat anything I want to eat now, but that's not the right way to approach it. The right way should be, let me always, as much as possible, do the best I can for my health and my weight. So a lot of times doctors will put you on a weight loss program, but it has to be individualized. And sometimes if it's not, patients give up. They really want to see results. And so what we do recommend is getting on a specific diet that probably meets your needs initially to see if it falls into your lifestyle. And if you have any questions, please put them in the chat and I'll be happy to answer them. What I usually recommend to start out with is a Mediterranean diet. That diet, now, doesn't have a lot of fast food in there. It does have a lot of wholesome foods, such as fresh fruits and vegetables. It also has beef, pork, chicken, or fish. It does allow for some wine in the diet, and you can have generous portions of most of that, but I would say watch out for the grains. Watch out for all the carbohydrates, because if you're not exercising enough, that will be stored as fat, as we had said before. Also, with weight loss, you do need to exercise, and exercising will help you lose weight. And I know some people are like, no, how am I going to put that in my schedule? I already have a lot of other things to do. But interestingly enough, the recommendation is to do at least 150 minutes each week to start. So what I tell people is lifestyle changes cannot all be done in 1 week. They can't be all done in 1 month. So I suggest that you do one lifestyle change a week. So if it's starting to exercise, you just try to get in the exercise that week. Next week, you may want to try changing your diet. Hi, Pam. Thanks for tuning in today. If you have any questions, we'll be happy to answer them for you. Just put them in the chat. The next week, if water is an issue for you, start drinking water. Just make sure you have your water bottle with you, and each week you add on to your successes. Lifestyle changes can be accomplished. You just have to give yourself some time. So exercising, we recommend cardio exercise, and that includes bike riding, swimming, brisk walking, jogging, Peloton. That is the rage now. That's all over the TV. I don't suggest Peloton to start out because those people are athletes. There's no way they're going to be doing that starting out. So just start with some very basic things. If you have a bike, go bike riding. Where I live at in Matthews or near Charlotte, North Carolina, there are lots of trails. You can go bike riding all the time. So find some time for yourself. Make this something for you. Do this for you and your family. Because what I have found is if the adults are exercising, the kids want to come in there too. So that's cardio exercise. And we went into that a little more earlier on. In addition to cardio exercise, you probably want to do weightlifting, or it's called strength training. And that helps, number one, build muscle. You want to build muscle because the more muscle you have, and I'm not saying bodybuilding now, just increasing the muscle mass that you have already, will help you lose weight much more efficiently. And in some cases, it also helps for older people, older women in particular. It will help them with their bone density, and it will help them with their balance also. So a healthy diet we've talked about. Now, the Mediterranean diet is not the only healthy diet, and we have talked about those diets earlier. And talk with your doctor or your health coach. Moi. And we can always work out the best type of diet for you. So let's move on to some other things that we need to be aware of. Smoking. Smoking always helps people elevate their pressure. And I know you're saying, well, you've asked me to lose weight and you've asked me to do these lifestyle changes. I know all of this cannot be accomplished at once. But if you make small goals for yourself between you and your doctor, make an agreement with them, and have an accountability partner, you can eventually get off your cigarettes. And I really feel, in my experience, more people are quitting smoking than we even keep track of. I mean, I've had patients come in and they're saying, you told me to quit smoking. I've quit for 8 months now. So that is to be commendable. So just remember, you're not in this alone. There are many people who are trying to quit smoking. But the other thing about quitting smoking is that, number one, you're preventing heart attack and strokes. And no one wants to have that in their family. It can be devastating to the family and to the individual. Also, it prevents cancers. Two cancers that can be very devastating is lung cancer and pancreatic cancer. And there are other cancers like esophageal cancer, throat cancer. So it's something you want to do, maybe not in the short term, but you'd want to do it in the long term. Additionally, there's a battle going on about sodium. The Affordable Care Act, which, as you know, was sponsored by President Obama and his administration, and now President Biden, and they worked very hard and very diligently to get that passed. And as a part of that act, they wanted to have the manufacturers definitely decrease the amount of sodium in foods. Now, I'm not sure if that is still going on, but what can you do? You can look at the labels. The lowest label I think I've seen is less than 300. Low sodium is supposed to be less than 200, but the lower, the better. If you do use canned vegetables, pour out the water, rinse it 2 or 3 times, and you will decrease the amount of sodium you have. It'll decrease it by half. And now frozen vegetables are a lot more prepared. They've got sauces in them and seasonings. So they can increase your amount of sodium and fat. So make sure you're looking at the labels to decrease the amount of sodium. Also, do not cook with extra sodium or use a low salt alternative. My favorite is Jane's mixed up salt. Where I found that, I don't know. I don't know whether someone recommended it to me, but I recommend it to all my patients because it has a lower amount of salt in it that has a lot of herbs. And really, if you really think about it, you don't really want the salt. You just want it to have a flavor. And Jane's mixed up salt has, and there's a lot of different varieties too, has a lot of flavor. Additionally, you can go online and find out which herbs go with which dishes you want to prepare. For example, chicken goes well with rosemary, and you can buy rosemary like plants, in the store, and just pull something off and put it in your food. Sage is another one. You can put that in your chicken. So look for other alternatives besides salt and pepper, because you will get the flavor you really want without the additional salt. Also, when you're going to the restaurant, ask them to hold the salt when they are preparing your foods, because that will help you in your quest to decrease salt. And to be honest, there are times when I have patients in my office and they're on 3 medicines and they're still working on their lifestyle changes. And I tell them, I am not adding any more medicine. I want you to reduce the salt. And sure enough, when they go back in, look at some of the packages they have there, they realize there's some hidden salt that they didn't realize. So salt can keep your blood pressure up artificially when you can help bring it down by decreasing the amount of salt. Alcohol is something that some people have difficulty with, and there are national recommendations for that. And as I said, with the Mediterranean diet, it does allow you to have a certain amount of wine per day. It's built into the diet because it's from the Mediterranean area where there's, people, have a lot of vineyards, and wine is very, they're accustomed to drinking it with their meals. But the national recommendations are that you can have a certain amount of alcohol per day, and it's 12 ounces of beer, 5 ounces of wine, and 1.5 ounces of hard liquor. Now, I am not recommending that on a daily basis. I do know some people do have wine with their meals, and that I think has its advantages because there is a chemical in there called resveratrol, which you can buy in the health food store, which has been known, they believe, to decrease the risk of heart attack. So that one I feel is probably something you want to do, you can do on a regular basis. But a lot of people can't even take that and feel okay. So I would say for your health, just take it, for special occasions or on the weekend. Now, I do know some people try to make up for all the alcohol that they didn't drink in the week. That's not what I'm saying. I'm saying moderation, 1 or 2 on the weekend. Alcoholism is still a major problem in this country, and many lives are devastated. I'm not speaking to the people who are alcoholics or anything, but just to know that many lives are not as productive as they can be because of the alcohol. And sometimes it can run in families. So just be careful with that. The other thing we need to discuss is stress, because stress can elevate your pressure. We've talked about lots of things that can decrease it, but stress can. And sometimes we feel like things are out of our control. With the COVID, many people are anxious, they're depressed because there's no control over whatever they can do, or there's too much control, and they don't feel like themselves anymore. Wear a mask, double mask, make sure you're 6 feet apart, and you have to keep all this in mind while you're, going about your daily activities. Sometimes children, they change the schedule at school for the kids. I spoke to my sister who has a daycare center, and I said, "Oh, is it time for you to pick up the kids?" Because she has an after-school program with her daycare. And she says, oh, no, no. Some kids, they only go on Monday and Thursday, and the other kids go on Tuesday through Friday. And, today's Wednesday, so I don't have to worry about it today. Now, she's an adult and she has to keep that in her mind. But what about the kids? The kids are probably very anxious and you can sense it in them. So we recommend that if you feel you need help, talk with someone, talk with your physician or your healthcare provider to get the numbers for someone who can help you through this time. Also, let's put a plug in there for exercise because exercise can help you decrease stress. Additionally, sometimes maybe you are anxious and things are just not going the way you wanted them to go. Maybe during this COVID time, maybe decide to take up a new hobby. There are lots of them. I was speaking to a friend of mine and she was saying that it's hard to find bikes anymore because people are buying bikes and they're riding them. Hooray! That's another way to reduce stress. Also, do relaxation exercises. And there are plenty of them online. You can do Pilates, you can do yoga. Those tend to be relaxing. And plus you're, moving your muscles around and making yourself feel better. Now, one thing I did not mention, I feel very strongly that anyone who has a diagnosis of high blood pressure should really have something to monitor their blood pressure. Why? Because we want you to know your numbers. The reason why is there are times when blood pressure can get out of control and you won't even know it. And if you're not monitoring it, you can't alert your doctor. So, yes, it is, Pam. It is very difficult with teenagers, especially with stressing and being at home. It is very difficult. So, get a blood pressure cuff. And Omron is one the cardiologists recommend, but it doesn't matter. Just get one. I think they're $50 on up, and just check your blood pressure once a week and keep your doctor alerted to what your pressure is. And you should know that too, just in case an emergency occurs and your pressure is sky high, they know that's not your regular pressure and they won't necessarily put you on any medications. So let's recap. Having a diagnosis of blood pressure. Yes, Mr. Wright. Exercising 4 or 5 days a week is excellent. Minimum 30 minutes of the same exercise because that will get your heart rate up. And if you can do more than that, that's even better. 64 ounces of water, you can do that. Just make sure you have a jug high enough because counting bottles, you can forget about it. It is a recipe for good health because, number one, you're replacing the water content. Your body is 60 to 70% water, and you need to replenish it. And some medicines that you're on, you need to drink water because the medicine takes extra water out, so you need to replenish it also. Plus, you will feel refreshed. I did, a 5-minute video on things that can increase your weight loss, and water was one of them. Water increases your metabolic rate, and that's the rate that you burn calories. So they have found that 90 minutes after drinking cold water, your metabolic rate, which is the rate that helps you burn calories, is still elevated. So it has a lot of other benefits. And there are some beverages that we drink that take water out of our system, namely coffee. Coffee can help take that extra water out of our system. And there are some people who are chronically dehydrated. They feel they don't feel themselves, but they don't know what's really wrong. But a lot of times people say they're dizzy and they're really like chronically dehydrated. So that is part of the recipe for good health. Thank you for reminding us. So let's get back to monitoring your blood pressure. Blood pressure should be monitored on a daily, well, not a weekly basis, so that you know what it is. And you should know that. Now, we actually have, I wanted to tell you this, we actually have blood pressure cuffs. And if you're into the tech type things, they can record your blood pressure, send it to the app on your phone, and keep records, and they have graphs and things like that. So if you're into the tech stuff, you will definitely be able to do that with some of this new technology. Any other questions today? Or any statements about good health? Okay, well, thank you for coming. I hope that these tips have helped you, but I want to leave you with a challenge. Sometimes exercising can be boring. So a lot of times I will challenge my patients to do a 5K. Now, a 5K is really 3.1 miles, 3.2 miles. So if you haven't done one of those, see if you, especially when the weather gets better, see if you can work up to doing a 5K. And they're all over the place. You know, Ronald McDonald House has them. The Alzheimer's Association has them. The American Diabetes Association has them. And they're a lot of fun, and you can bring your family with you. So my name is Dr. Hope Watts, board certified family physician, health coach, speaker, author, and lifestyle expert. Please follow me on Instagram, Facebook, Twitter, and LinkedIn. And I just want to remind you, my book will be published probably in the next several months. So stay tuned, and I will give you more information about that as the time draws near. Thank you, and have a wonderful day. Oh, you're welcome, Mr. Wright.